Well, that's a good transition into intellectual wellness,
Mhm.
which is the lifelong pursuit of learning. Um, so you've already kind of touched on the areas that you want to know more about. You mentioned urogynecology. You
Mhm.
mentioned robotic surgery.
Mhm.
So how did your path take you to these specializations? Do you just read about it and are fascinated and want to know more about it?
Partially. Uh, so let me kind of backtrack a little bit. When I first started private practice in 2000, almost 15 years ago, I did, the mainstream OBGYN
Mhm.
that I had been taught. The three most common complaints that women would have were fatigue, weight gain, and low libido. And so I followed the recipe that I'd been taught, but it just didn't really seem to address their problems adequately to my satisfaction and their satisfaction. So I went, I kind of went out of the box, and outside the box, I mean, and started to look at other alternatives for managing this. And that's when I got a lot more into the hormonal balancing and such. And at the same time, I also was learning additional surgical procedures, laser, vulvar, and vaginal procedures. So I guess that what drives me is to achieve the outcomes that women want,
Mhm.
and ultimately it's kind of, the outcomes that I want, because I feel better if I've helped somebody.
Sure.
So that has been the driving force there, and then from there went on to finding better surgical procedures. So going on into robotic surgery, because we know that type of surgical system allows for speedier recovery, for less pain, having the women return to work much quicker, and less complications. It was kind of a no-brainer, so it wasn't something that we had readily available here, so I sought out to be able to bring it to this area, but I had to go elsewhere in order to operate. So you talk about sacrifices, so a few more sacrifices there, having to travel in order to do that kind of surgery.